Lung cancer is a type of cancer that begins in the lungs. Your lungs are two spongy organs in your chest that take in oxygen when you inhale and release carbon dioxide when you exhale. Lung cancer is the leading cause of cancer deaths worldwide. Lung cancer awareness continues to grow thanks to a surge of scientific research and aggressive public awareness campaigns about the harms of cigarette smoking and the health benefits of quitting. So in this video, we're going to discuss lung cancer and its prevention. The video is going to be amazing, so make sure you stick to the end. Lung cancer is a malignant lung disease primarily caused by cigarette smoking. It often has no obvious symptoms until the disease is quite advanced and has a low rate of survival. Treatment for lung cancer mainly involves surgery and chemotherapy. Radiation therapy and targeted drug therapies may also be used. In recent years, lung cancer has been the most common cause of death from cancer among men and women in New Zealand, accounting for nearly 20% of all cancer deaths. Cancer prevention is an action taken to lower the chance of getting cancer. By preventing cancer, the number of new cases of cancer in a group or population is lowered. To prevent new cancers from starting, scientists look at risk factors and protective factors. Anything that increases your chances of developing cancer is called a cancer risk factor. Anything that decreases your chance of developing cancer is called a cancer protective factor. Some risk factors for cancer can be avoided, but many cannot. For example, both smoking and inheriting certain genes are risk factors for some types of cancer, but only smoking can be avoided. Regular exercise and a healthy diet may be protective factors for some types of cancer. Avoiding risk factors and increasing protective factors may lower your risk, but it doesn't mean that you'll not get cancer. The best way to reduce your risk of lung cancer is not to smoke or to avoid breathing in other people's smoke. If you stop smoking before cancer develops, your damaged lung tissue gradually starts to repair itself. No matter what your age or how long you've smoked, quitting may lower your risk of lung cancer and help you live longer. Secondhand smoke is smoke from other people's cigarettes or cigars, as well as the smoke that they exhale. When you inhale secondhand smoke, you're breathing in a lot of the chemicals from cigarettes. There are about 70 chemicals in secondhand smoke that are known to cause cancer and hundreds more that are toxic. Even brief exposure to secondhand smoke can be harmful. According to the Center for Disease Control and Prevention (CDC), secondhand smoke is responsible for more than 7,300 deaths from lung cancer each year among people who don't smoke. It's estimated that up to 15% of lung cancers in men and 5% of lung cancers in women are related to on-the-job exposures to cancer-causing substances, carcinogens. The risk of lung cancer varies by the carcinogen and the number of years of exposure. With asbestos, for example, the lung cancer risk increases by 14% for every year of occupational exposure. Employers are required to provide their employees with material safety data sheets, MSDS, on the chemicals used in the workspace. Make sure to read these documents in full and ensure that you're provided with the proper protective gear when you're on the job. The National Institute of Occupational Safety and Health (NIOSH) recommends different forms of protection based on an occupational chemical's air protection factor. Chemicals with a high APF require respirator masks instead of face masks. The type of respirator mask can also vary. An APF of 10, for example, requires a half-mask respirator with an N95 filter, while an APF of 1000 requires a powered air purifying respirator. Although laws have reduced exposure to secondhand smoke in public, it's important to avoid breathing in secondhand smoke at home and at work as much as possible. There is strong evidence to suggest that regular exercise can lower the risk of developing lung cancer and other types of cancer. Most adults are recommended to do at least 150 minutes, 2 hours and 30 minutes of moderate intensity aerobic activity each week, plus strength training exercises on at least 2 days each week. Research also suggests that eating a low-fat, high-fiber diet, including at least 5 portions a day of fresh fruit and vegetables and plenty of whole grains, can reduce your risk of lung cancer, as well as other types of cancer and heart disease. There are hair-like crystals found in many types of rock and are often used as fireproof insulation in buildings. When asbestos fibers are inhaled, they irritate the lungs. Many studies show that the combination of smoking and asbestos exposure is particularly dangerous. People who work with asbestos in a job, such as shipbuilding, asbestos mining, insulation, or automotive brake repair, and who smoke have a higher risk of developing NSCLC. Using protective breathing equipment reduces this risk. Radon is a radioactive gas that you can't see or smell, but it's the second leading cause of lung cancer after smoking, and it's the top cause of lung cancer among non-smokers. Radon is a radioactive gas that's released when uranium in rocks and soil breaks down. It can seep into the water and air supply and enter your home through cracks in the floors, walls, or foundation. It can build up in your home over time. According to the Environmental Protection Agency, EPA, nearly 1 in every 15 homes in the United States is estimated to have elevated levels of radon. You may want to have your home tested for radon. you can get a home testing kit or call a specialist who can test your home for this gas. If you find high levels of radon in your home, a specialist can provide solutions on how to reduce the levels. In the past, the tools used to screen for lung cancer were limited and could only detect the most advanced cases. The tools used today have improved considerably and include low-dose computed tomography (CT), a type of X-ray imaging study especially effective in heavy smokers. Whether you're current or former smoker, animal screening for lung cancer can be beneficial if you have a history of heavy smoking as measured by pack years. A pack year is calculated by multiplying the number of years you smoked times the number of packs you smoked per day. While lung cancer screening doesn't prevent cancer, it reduces the risk of death by 20%. Simply by identifying cancer early, if and when it occurs, screening may also be appropriate for people who've been exposed to high concentrations of carcinogens in the workplace. Some advertisers have gone out of their way to suggest that nutritional supplements can prevent lung cancer and other types of cancer, while a 2019 study in the European Journal of Medicinal Chemistry concluded that non-smokers who consume a high concentration of beta-carotene in food have a lower risk of lung cancer. The same was not true for smokers. In male smokers specifically, the use of beta-carotene supplements increased the risk of lung cancer by 18%. Other supplements have raised similar concerns, including retinol, derived from vitamin A, lutein, and vitamin E. As a general rule, only take supplements if you have a confirmed nutritional deficiency or if your healthcare provider has advised you to do so. It's always better to get your nutrients from a healthy, balanced diet than from a pill. When lung cancer is caught early, it's easier to successfully treat the disease using effective and appropriate treatment. Aimed at improving early detection of lung cancer, a recent national lung screening trial looked at the benefits of using a low-dose CT scan rather than a typical chest X-ray to screen for lung cancer. Compared to a traditional CT scan, a low-dose scan produces 5 times less radiation. As it turns out, the study found that people who were screened with the low-dose CT scan had a greater chance of survival than those who got standard chest X-rays. Soon after the results of this massive clinical trial were published, the U.S. Preventive Services Task Force put new guidelines in place recommending yearly lung cancer screening using low-dose CT scans for people who are considered at high risk for developing lung cancer. Lung cancer is a very challenging cancer to treat. Cell type and stage are the most critical factors in determining the survival rate is the stage at the time of diagnosis. Those that are diagnosed at a localized stage may be curable. Unfortunately, most people are diagnosed when the disease has spread outside the chest, advanced or distant, or involves the nodes in the chest regional. Also, the lungs are very sensitive organs and may not handle some forms of treatment easily. This combination explains why lung cancer has one of the poor survival rates of all cancers. The overall 2-year survival rate of those diagnosed with lung cancer is 25%. At 5 years, the survival rate drops to 15%. It's important to discuss the goals of lung cancer treatment with your doctor. Some treatments may be used to control cancer. Home remedies and homeopathic remedies won't cure cancer. But certain home remedies may help relieve some of the symptoms associated with lung cancer and side effects of treatment. Ask your doctor if you should take dietary supplements, and if so, which ones. Some herbs, plant extracts, and other home remedies can interfere with treatment and endanger your health. Be sure to discuss all complementary therapies with your doctor to make sure they're safe for you. Options may include meditation. Relaxation and reflection can reduce stress and improve overall quality of life in cancer patients. Yoga, combining breathing techniques, meditation, and stretching. Yoga can help you feel better overall and improve sleep. Massage, with a qualified therapist, massage can help relieve pain and anxiety. Some massage therapists are trained to work with people with cancer. And the last one is acupuncture. What is acupuncture? When it's performed by a trained practitioner, acupuncture may help ease pain, nausea, and vomiting, but it's not safe if you have low blood counts or take blood thinners. So be careful. Let us know your opinion in the comment section down below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Please click on the next video to watch for more health info. Thank you very much.